Hello, you must be Kanisha. My name is Heather, and I'll be doing your interview today. Are you ready to get started?
Go ahead. Yes, Miss Heather, I am ready and thank you so much for having me today.
Tell me about a time in clinicals where you delivered high quality, patient centered care to individuals, families, groups, and communities in varied settings.
Yes, I delivered high quality patient centered care to an individual with their family present. The patient was diagnosed with COPD and exhibited shortness of breath. They also had limited mobility. So one day when I was going to do my rounds, I went in the room and I found the patient lying flat on the bed. I also noticed that their O2 saturation had dropped to about, I would say, 89, and they weren't positioned properly. So I went in the room, I elevated the bed, and as soon as I was elevating the patient in bed, the family members walked in. So I introduced myself to them. I told them that I was one of the nursing student that is working with their, you know, family today. Um, so I went ahead and continued to take care of the patient. Um, After I fixed the patient appropriately in bed, I elevated their head at about, I would say, 35 degrees. And then I watched the patient O2 saturation came up to about, I would say, 97%. And I also, waited until, I felt comfortable. Their respiration increased to about, I would say, 17 per minute. Um, and in that situation, I believe that I did provide, quality care for this patient.
Why does this example meet this objective?
This example met the objective because I believe I was able to deliver high quality care and provide helpful information per HIPAA, to the family and how they can help or assist in the care of their family members. This also allowed them to better understand the important steps in giving care.
Tell me how you use something you learned from your class assignments to implement best practice, professional values, and standards into compassionate nursing practice.
One of my class assignments, we had to come up with a discharge planning for one of our patients who was diagnosed with hypertension, and I was responsible for ensuring and providing the patient with a resource to help them with their transition dealing with this new diagnosis. So, what I did, I went over some of the healthy eating habits and some of the food choices. I also gave the patient a brochure of, foods that they can choose that, will help their disease. For example, low sodium. And while I was there going over, the diet or the food choices, the patient went ahead, called her daughter, and asked her to go to the grocery shop and just to buy, some of those groceries. So right there and then I could see where, she was happy and she was actually getting this done. So I think this was one of the first steps in implementing healthy eating habits that would also benefit the patient at this point.
Did the outcome using this knowledge improve the outcome of the situation you used? Why or why not?
Yes, I believe this knowledge has improved the outcome because I remember one day I did a follow up call, just to check on my patient, and she told me that she had fewer symptoms having to stick with, the new diet and using that brochure to select her foods. And she said that she tried those and those eating habits, sticking to her diet, she realized that she's been feeling much better.
Tell me the example of how you demonstrated cultural and global congruency in the healthcare environment with diverse populations in promotion of healthy lifestyles and preventative health screenings in clinicals at FTCC.
Yes, I demonstrated cultural and global congruency during a clinical session. I had a patient who the doctor had ordered a blood transfusion, and as a nurse, I assessed the patient and provided the appropriate information that the doctor recommended for the treatment. I went ahead and reviewed the patient's history and found out that this patient was a Jehovah's Witness. I also went and checked, the information that we have pre-transfusion of blood, for example, the typing as well as other blood-related illnesses. Later, the patient declined for the option for treatment. I had to go ahead and, notify the physician who, gave the order and the option. So after that, the patient agreed for, attempting a different route, which would involve drug administration, instead of a blood transfusion.
How does incorporating this impact how and what you present in patient discharge information and education?
For this particular patient discharge education, I included some information in the practice, and also explained to her that, we do value her cultural beliefs and having the right to choose, and also to see what other options are available. However, studies have shown that blood transfusion would have been the line of treatment in this situation, but she chose, another option, and I gave her the information and she chose. I was happy.
Can you describe a situation in SIM or clinicals at FTCC where you functioned as an effective member of the healthcare team, demonstrating excellent interprofessional collaboration?
During a SIM session, we learned the skills for urinary catheterization. As a nursing student, I was responsible for understanding and practicing the skill and the techniques. During this practice with one of my classmates, we focus on helping and maintaining sterility. So we planned that one person would take care of the patient and the other person will deal with the catheterization. I was responsible for inserting the catheter, while my other team member would pull the drape, turn the patient, maybe take the gown out of the way. And in doing so, we were able to work more efficiently, even though we had different roles, but working together for one common goal, which was to prevent an infection.
What skills have you learned in classes at FTCC have increased your communication skills in SIM and clinicals at FTCC?
Yes, I've learned the skill for appropriate documentation. During my FTCC clinical experience, one of our instructors taught us how to document. So from there on, I've used this to document each team member task or assignment. And also, documentation in real time is important because it can be used as a legal record, as well as keeping the information. For my clinical work, I try to document in real time, which is a form of communication in the patient's care. I gained that skill as a team as I worked together with my classmates in order to provide high quality care in the clinical setting. These collaborative communication efforts increase patient safety and outcomes.
Describe how you demonstrated beginning skills in point of care leadership, management, and care coordination using effective communication skills through either successful completion of class projects or clinical situation or experience.
I have demonstrated leadership skills in my clinical experience. I was called to assist with a patient who was totally dependent and needed a bed bath. And as a nurse, I was responsible for gathering the supplies, like the linen and other stuff that is used, for the patient's bath. My colleague had some challenges turning the patient. After this observation of excessive maneuvering, I suggested preparing the bed while simultaneously turning the patient to decrease the excessive positioning that can be exhausting for the patient as well as the clinical care team. We were able to complete the task more efficiently and effectively which allowed more time to complete other work tasks.
How do you plan to grow and strengthen your leadership skills in your practice as a nurse?
In an effort to grow and strengthen my leadership skill, I plan to lead by example and have effective communication as well as what I use, as mentioned previously. I would be sure to assist in order to get my hands-on experience while communicating with others to get the task done.
Describe how you implement safe and competent care to individuals through both system effectiveness and individual performance in varied healthcare settings.
Yes, I had a patient who had diabetes, and I was responsible for drawing up insulin. So what I did was to check the blood glucose. I read the order, and I went ahead and got another nurse to confirm the safe dose. And based upon that, the patient was given the right amount of insulin as per doctor order, as well as their blood glucose readings.
Tell me about a specific clinical situation in which you identified something unsafe for a patient and what you did about it then and why.
Yes, during one of my clinical rotation, I was responsible for doing safety rounds on the patient. I found one of the patient that had unsteady gait, walking down the hallway without his walker. I approached him calmly, invited him to sit, then I get the walker and I reminded him to use this whenever he wants to walk or to move around. In doing so, I believe this had prevented the patient from falling and decreasing the risk of an injury.
Would you change what you did then now? Excuse me. If so, why and what would you do differently?
No, I would not change what I did for that client because I believe I used the right intervention that would decrease the risk for fall and injury.